Good evening, ladies and gentlemen. Welcome to this very interesting topic for today. You see, a lot of people, we hear about hypertension. And oftentimes when we go to the hospitals, we go to other facilities, we hear that it is something that is for life and cannot be reversed. Now, we're going to look at these things from a holistic perspective. Let's look at these things together. Let's see if truly we can actually achieve reversal, or it's really a sentence for life. That's when one has hypertension. So I remain my humble self, Lucky, aka Dr. Drugs, and we're presenting today high blood pressure management and reversal. This is very crucial because a lot of people have hypertension, and we know that this is a silent disease, and that's why Health and Wealth team, collaboration with my senior colleagues and mentors, as aforementioned, and much appreciation to them, we're presenting this for free to see how we can help a lot of people come out of this issue and prevent themselves from having this issue. In fact, some people believe that they are sentenced to have high blood pressure because they feel that their father or their mother or one of their relatives also had it, and they feel that there's nothing they can do about it. But believe you me, genetic predisposition is not a genetic sentence. We're going to go deeper a bit. I remember humble self, Dr. Drugs. Yes. So we're going to talk about lifestyle diseases briefly because the main topic of today is a lifestyle disease. So let's see what lifestyle diseases are. And then we're going to talk about hypertension. Then we delve into management and reversal. Then we'll talk about diabetes briefly. In fact, we're going to run through diabetes because it's a topic for another day, because we're going to be talking about reversal of diabetes, type 2 diabetes, some other time. And then we'll talk about a very crucial factor that is really one of the major things that is provoking other lifestyle diseases. In fact, this is the chairman of other lifestyle diseases. You understand? And that's why we're going to talk about it as well for maybe about 10 to 15 minutes. I always say that the greatest assassins on earth are not the ones we see in the like Mission Impossible, the one that, is it Tom Cruise or somebody did that? Or we're not talking about 007, James Bond. The greatest assassins on earth still remain cholesterol and stress. These two assassins have been slaughtering people from at the highest killers of people on earth today. We're talking about from cardiovascular diseases to cancer to a lot of issues that we don't want to talk about. In fact, cholesterol, basically, one of the major ways it kills people is by ischemia, which is simply cell death as a result of hindrance of blood flow through the arteries of affected cells, leading to lack of oxygen and food to the affected cells and hence killing them. In fact, we'll see how this happens. So ischemia just means, once you hear me say ischemia, I mean blockage of blood flow to a particular area leading to cell death, or cell death due to blockage of blood flow. Then, of course, you know that stress, a lot of us do not understand that stress actually damages DNA. And you know that DNA is in charge of everything about us. So what happens when this DNA is damaged? It can lead to uncontrolled proliferation of cells. And that's the long and short of the story of cancer. Cancer simply means uncontrolled, derogatory, or detrimental or excessive replication of cells. That's why that part of the body that is having an issue is what's getting larger, because the DNA that's supposed to tell the cell stop dividing is actually damaged as a result of stress and other factors that come about as a result of stress, which include things like free radicals and reactive oxidative species. And that's why antioxidants are very useful. And you see that we have different types of antioxidants. When you say antioxidants, a lot of us think we're talking about vitamin C only, which is ascorbic acid. But no, we have a lot of other antioxidants, from lycopene to glutathione and to a lot of other vitamin E. We have, that's the tocopherol analogs. We have the vitamin A section. These are all antioxidants and more that we can actually go. Then, you know, we have sulfonophins, the ones we find in cruciferous vegetables. We have them in the cabbage and the kale and all that. These are antioxidants that help to prevent and help to mitigate cancer. In fact, some people have postulated that some powerful antioxidants found in what we call soursop has been known to help to pause or reverse or counter cancers like prostate cancers and all that. These are things, although I've not done the research yet, but I've been hearing about it for a while. Maybe we'll delve into that later. So you can see lifestyle diseases are linked to one's lifestyle. They are non-communicable diseases. An example of such lifestyles that actually provoke these lifestyle diseases include lack of physical activity, poor dieting, alcoholism, smoking, which we know directly damages DNA, and then substance abuse, lack of rest, and other lifestyle choices that may affect our health badly. Lifestyle diseases include cardiovascular disease, which is heart diseases. Example, what? Hypertension. Let's take note of this. Now, atherosclerosis simply is just a process that describes how cholesterol blocks the blood vessels and forms what is called an atheroma and blocks blood supply, leading to what I mentioned before, ischemia, which is cell death due to poor blood flow. Obesity, as we all know, is when one is overweight. Let's take note of this, because being overweight means that the system is going to be stressed, and the factors that supply blood to the body need to supply an extra mass with a higher pressure. Then type 2 diabetes as well, stroke, respiratory ailments, fatty liver disease, high blood cholesterol, heart attack, and more. Now, prevention of these lifestyle diseases entails avoiding what? The avoidable risk factors. These are just examples of the cardiovascular diseases we have: coronary artery disease, hypertension, stroke, angina pectoris, all the way down to one of my favorites, which I like talking about often, which is heartbreak syndrome, aka Takotsubo syndrome, which is sudden enlargement of the heart due to emotional stress or physical stress, and also leads to constriction of the blood vessels of the arteries of the heart. And that's why you see that when people are in shock, especially women, they don't hold their head, but they hold their heart. So guys, we have to take it easy with the heartbreaks, so we don't finish our women. Then we talk about congestive heart failure, carditis, and all that, all the way down to venous thrombosis, aka deep vein thrombosis. These are all cardiovascular. So let's delve into what is the heart. This is a muscular organ that pumps blood through the blood vessels of the body circulatory system, and it's about the size of what? A closed fist and located in between the lungs in the middle part of the chest region, but the tail points a bit left. If you permit me to just speak some scientific terminology, it is located around between the apex of the heart. That's the tip here, is located between the 5th and 6th intercostal space mid-clavicular line. That's how you see that the heart is a bit tilted to the left. That's that. Now, this is basically the function of the heart: supplying cells of the body with oxygen and nutrients, and taking away waste products and carbon dioxide to the lungs, where it's now exchanged for oxygen as we breathe in, and the cycle goes on and on. In fact, one is clinically dead when the heart stops and there's no brain activity. If we look here closely, you will see one of the typical examples of what I mean by cholesterol causing serious problems. Now, you can see that at this point in time, his blood is even completely blocked, and everything on this other side begins to die. That's what that ischemia means. And this is one of the lifestyle diseases we're talking about here. You can see myocardial infarction, which is not cardiac arrest. When you say myocardial infarction, we're talking about heart attack. That's not cardiac arrest. When you see somebody is having a heart attack, people say, hey, the person is having is already dead or something. No, a heart attack can lead to a cardiac arrest. But heart attack just means myocardial infarction, which is heart cell death due to poor blood flow. Then we have angina pectoris, which is that pain people feel in the middle of their chest, and so on, so forth. You see the definitions of myocardial infarction. Sudden cardiac death, talking about angina pectoris as aforementioned, pain as a result of dying cells of the heart, crying in pain. That's basically what it is. We have stable and unstable, with the unstable one being the worst, which is unprovoked, when the person is not doing exercise or doing anything, the heart, just the chest region is aching the person, that person is in serious danger. When the person has to walk or climb up the staircase before he feels that pain, well, there's still hope for that person, but such a person has to seek medical attention, and that's called a stable angina. The symptoms of coronary artery disease, shortness of breath, extreme tiredness, all the way down to chest or upper abdomen that chest pain, burning pain or pressure in the chest or upper abdomen that radiates to the arms, especially the left arm around this area. We should be careful when people feel that kind of pain and all that. So we are heading to our destination. Risk factors for coronary artery disease are them. These are the gang members of In fact, the lifestyle diseases, you see them here: hypertension, diabetes, obesity. You can see high blood cholesterol and all that line up there. This is how people help to resuscitate people. It's not a joke. Everyone has to learn how to, lock their fingers and do this so fast, and also give 8 breaths of life, per minute, just to help to resuscitate people. And it's called the cardiopulmonary resuscitation. That's just a brief summary of what it is. Now, hypertension is where we are coming to. So, what is this definition? It is a sustained elevation of blood pressure above normal. Now, blood pressure simply means cardiac output times peripheral resistance. Please, let's take note of this formula because we're going to be talking about it very soon. Underlying peripheral resistance, this is where we are coming to. A lot of people have high blood pressure because of what? Peripheral resistance. And it's simply the resistance that must be overcome to push blood through blood vessels to enable blood flow through the circulatory system. So if the blood flow is blocked by substances we are going to talk about shortly, the heart will have to have to have a compensatory increase in blood pressure. And that is the origin of what? Hypertension. Now, we'll soon ask ourselves a question shortly. What will happen when we remove these substances that are blocking blood flow? Does it not mean that the heart will need less pressure to pump? And that is just a tip of the iceberg of what we're going to talk about. And then you and I will ask ourselves a very simple question. Is hypertension truly reversible or not? And then we'll answer at the end of this. So cardiac output simply means the amount of blood that is pumped through the heart per minute. That means when you see two people fighting at the bus stop for change or having an argument, because the heart is pumping with so much speed, let me put it that way, it's pumping blood so fast, hence the blood pressure does what? Rise. So anything that leads to an increase in cardiac output or peripheral resistance or both automatically lead to what? Blood pressure. And that's the origin of what? High blood pressure. Voila. Cholesterol deposits in the blood vessels, atherosclerotic plaques increase what? Peripheral resistance and cause what? High blood pressure. Please, if you can screenshot this place, kindly do so. Take a picture of this place because we're going to refer to this very soon, and then we'll understand whether high blood pressure is reversible or not. Look at how all the shawarma, the fufu, the amala, all the pizza, and all the yam, the rice, the spaghetti, the indomie, this is where they come to lodge here and making it difficult for blood to flow through this place. What do you think they have to do? It has to pump with a higher pressure to squeeze through all these blockages. Now, remember the question we're asking ourselves. When we take these blockages out, what will happen? You see that the heart will need less pressure to pump, and it will begin to pump freely, as the above part of this picture is depicting. But we have different types of hypertension as we've talked about before. And then you see it is postulated or hypothesized that about 95% of cases are as a result of unknown causes. But we're going to look at this part very closely because it has also been found out that a lot of these so-called unknown causes is as a result of what? Peripheral resistance. So if about 90 to 95% of cases as a result of peripheral resistance, does it mean that if we can remove this peripheral resistance, that about 90 to 95% of cases of hypertension are reversible? Let's ask ourselves this question, and we'll put that at the back of our mind as we move on. Secondary hypertension simply means hypertension as a result of identifiable causes. And that means we know what caused the hypertension. And if we withdraw the cause of this hypertension, that means the people will go down. I always give an example. I gave an example the other day at Sheraton, where I asked the people I was presenting to that if somebody goes to the bank and deposits $200 million and is about to leave the bank, and then the bank manager calls the person and says, "Sir, Mr. XYZ, you deposited this money in the wrong account." At that point in time, the person's blood pressure will go up. But you can imagine what happens when they go back to the system and say, "Oh, Mr. XYZ, the 200 million you deposited in the wrong account, it did not go. So your money is still in your account." The blood pressure goes down. You can comfortably say that is what? Financial hypertension. And that means it is reversible. So the identifiable cause there was that the man thought he had the financial crisis. But when the financial crisis was removed, the BP went down. So that is why, that's just a simple definition of, or simple depiction of what secondary hypertension is. We also have Pregnancy hypertension. Pregnancy hypertension happens in about 8 to 10% of cases where we have people that have high BP as during pregnancy, and this happens during pregnancy and is resolved quickly after pregnancy. And that's why you see that some people are told that they have to, there's something called eclampsia and preeclampsia. You hear that when they talk about giving magnesium compound, the magnesium salt, to help the women to handle the situation. But it usually reverses on its own after the delivery of the child. Or magnesium sulfate, yes. So, and you can see that a hypertensive crisis, that is, can be divided into hypertensive urgency, that is when we have hypertension above 180 over 120, but there is no end organ damage. That's urgency. But when there's an end organ damage, where you can see the person is already almost getting, if I see the person is already collapsing, and the person is about to have what's called a TIA, or is already having a stroke, then it's a hypertensive emergency because there's an end organ damage, amongst other types. It's a silent killer, but sometimes when it wants to pity people, can cause headaches at the back of the head, especially in the morning, lightheadedness, altered vision, fainting episodes, etc. This is the only way you can measure blood pressure. You cannot measure blood pressure with high gauge. A lot of people say, I'm not hypertensive, I can feel it. It's not true. Some people go for something else and discover that they're hypertensive when they were going to check for somebody. In fact, the other day, someone went to took the mom to go and check her sugar level. And the doctor just said, just check your own. And they were surprised the guy was about to break a record because his own sugar was super high. And these are how these kind of things could be. You must have to measure them. A typical example is hypertension as well. As I was mentioning, people go to the dentist to go and check their teeth, and just okay, let's just casually do a routine check, and they find that they are seriously hypertensive. They have no idea. That's why you see some people, they sleep and they don't wake up, and then other innocent people are accused that they are the ones that killed them, whereas not knowing that it's hypertension that took their lives while they were sleeping. So that causes the risk factors of hypertension. You see, other lifestyle diseases include fatty liver disease, high blood cholesterol, and a lot of others, obesity and all that. All those other lifestyle diseases are also risk factors. Then we have smoking, alcoholism, poor dieting. I always use this cat as an example. Look at the eyes, it's already so high. Look at the alcohol he's drinking, he's already obese. Look at the ascites, the stomach, or aka pot belly, stomach is already full of liquid and a lot of visceral fat is already there. This is just in fact, when I say a recipe for hypertension, this cat you're looking at here, that's it. Of course, kidney diseases can lead to hypertension. We'll talk about that shortly. Now, prevention and management and reversal. Beautiful. You see, lifestyle modifications include, we have to monitor our blood pressures regularly, avoid excess salt intake, exercise, weight management. Let's take note of this. Let's take note of this Mediterranean diet. I always love that picture. Quit smoking, reduce alcohol intake, because excessive alcohol intake directly leads to bad cholesterol in the system. That's VLDL, that's very low density lipoprotein, and LDL, which is low density lipoprotein. These get excessively dumped in the system. Then, of course, use of appropriate medication. Before appropriate use of appropriate medication, let us also remember to rest, because when we are overworked, our system, the BP, is already knocking on the door because we need to rest. In fact, lack of rest can actually provoke high blood pressure directly. Now, use of appropriate medication, this basically work by reducing cardiac outputs, that's the rate of the heart pump, and a lot of them work by reducing peripheral resistance. Let's take note of this again, because we're going to talk about this shortly. Take note of how a lot of the medication we take help to reduce peripheral resistance, either by dilating the blood vessels or clearing the cholesterol blockage in the system. You see, I will mention some of these drugs that are familiar with a lot of us. And then you ask yourself this question: if reducing peripheral resistance helps blood to flow, as in making the blood vessels maybe wider, or by reducing the peripheral resistance, the blood pressure goes down, why is it that we cannot apply some other way to reduce this peripheral resistance and also reduce our blood pressure? Must we have to always swallow drugs of hundreds of thousands that when you withdraw, the blood pressure goes up? I'm asking us this question, and we can answer this question later. Then we use of natural pharmaceuticals in management and reversal of hypertension. This is one of the best pictures I have on this my system. All things bright and beautiful. There's no Semoris, no Azul, no Benson, no Seremi. There's no dry gin. There's no whiskey. There's no Coca-Cola. There's no Pepsi. There's nothing. Just all things bright and beautiful and natural. This is how we tend to eat. We have to eat. And you see, it's called the Mediterranean diet. So that means it's even named after a particular race or group of people. That shows you that this is something that must have been noticed, that when people consume foods like this, their blood pressure is fairly better, at least. So 1 in 3 adults suffer from hypertension. It kills up to 18% of the general population. So you can imagine that if we are 200 million people in this country, 36 million, if all 6 million, 36 million would be killed by hypertension. That's a very serious. In fact, I don't think Lagos State is up to 36 million people. So you can imagine. Yeah, so you see, complications of hypertension include eye problems because of the hypertensive retinopathy, which is damage to the eyes leading to vision loss via hypertension. Then they have stroke. A lot of people have hypertension and then they have stroke. I have a patient that had an accident and was rushed to the hospital, but because he was so impatient to wait, because he had a lot of businesses, oil, container and everything, he was just so eager to leave the hospital, and he kept getting angry with the nurses. And right there, while they were treating him for the accident he had a stroke, because his blood pressure rose up as he was worrying about his business, and then he had a stroke, and then he had to relax, and he was no longer in a hurry. So you can see that hypertension leads to stroke oftentimes. Then we have heart problems like hypertensive heart disease. You hear some people, when they go for what is called an echocardiogram, you see that the heart has been distended or enlarged or something. It's because the heart is a muscle, and when it pumps so hard for so long, it begins to change its form. Then we have heart failure, kidney problems as well. Well, we have just bear in mind that the kidneys play a very large role in regulation of blood pressure, and know that there are baroreceptor cells in the kidneys that tell the kidneys that the blood pressure of this in the system. And so when cholesterol is blocking the renal artery, we have what is called renal artery stenosis. And you can see that the kidneys will receive a false sense of low blood pressure, and they go through a cascade of reactions that I don't want to bore us with, because you start hearing me saying things like angiotensinogen, so angiotensin 1. You hear me talk about renin. You hear me talk about angiotensin converting enzyme inhibitors, which we consume a lot, which patients consume a lot with the hypertensive. Now, when you block that angiotensin converting enzyme, you find out that it leads to the decrease in the production of what is called angiotensin. And this angiotensin is very, 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 very crucial in regulation of blood pressure, because excessive production of this angiotensin will lead to constriction of blood vessels and lead to an increase in peripheral resistance. Remember, we're talking about peripheral resistance not too long ago. So that's why people take medication like lisinopril, which is an angiotensin converting enzyme inhibitor, hence inhibiting the production of what? Angiotensin. Of course, hypertension leads to forgetfulness and economic problems, and increase in medical bills and death. So, beautiful. You will now understand why I was taking my time to try to explain, even though if I'm to break it down, just that the kidneys also regulate blood pressure, because they lead to production of angiotensin, and angiotensin can actually lead to a constriction of blood vessels and also lead to increase in peripheral resistance. So we need to patients take drugs like lisinopril, which are angiotensin converting enzyme inhibitors that prevent the production of this angiotensin. That's how you see. So, but the question now is this: all lifestyle diseases are mostly reversible, including hypertension. But are we aware that an evidence is the presence of something called DASH, which is dietary approach to what? Stop hypertension. This is not dietary approach to pause hypertension. All you need to do is to go to Google, type DASH and type hypertension in front of it and read for yourself. That means it is possible to stop hypertension, because the meaning of DASH does not mean dietary approach to pause or to postpone, or it means to stop hypertension. That means hypertension is what? Stoppable. So I wonder why I keep hearing that everybody that has hypertension, that they cannot have it reversed or stopped or reduced or mitigated. That means it's stoppable. I will show us the evidence now. So I'm not the one that is saying it. You can go and type it on your own, check on by yourself, and then show your health practitioner and ask, does it mean that hypertension is stoppable? And then you hear what they have to say. Another question I want to ask us is this. Why are many antihypertensive medication vasodilatory? Because you know that when you dilate the blood vessels or you reduce the contraction of the blood vessels, it allows blood to flow better. So if we are concentrating on making blood flow better to reduce peripheral resistance, what is actually blocking this blood flow? These are questions we have to ask ourselves. Yes, apart from old age and other factors that make the blood vessels to be less elastic, why is it that in young people these days, we are having a lot of these people suffering from hypertension? It's no longer from the age of 40, as we were told in those days. People are having hypertension from the age of from their early 20s. So the question is why? So is there anything we are doing wrong? And this is the reason why we are here. We're going to find out shortly whether there's anything we are doing wrong. And then ways that this can be achieved include dieting, weight management, detoxification, exercise, and professional fasting. What I just mentioned now are the ways we can achieve reversal of hypertension. These are just some of them. Now, I want us to focus closely on this vasodilatory part. Remember, I mentioned that peripheral resistance times cardiac output leads to an increase in blood pressure. So if we take away what is blocking these blood vessels and preventing the free flow of blood, does it not mean that the blood pressure will go down? I'm going to show us some ways we can actually achieve this. And one of the major ways is here, weight management. Because being overweight predisposes us towards high blood cholesterol. And this high blood cholesterol leads to blockage of the blood vessels. And being overweight means that the heart has a wider area to pump blood to. And that's why it's very, very important that we tackle this issue. Remember that one of the risk factors of hypertension is what? Diabetes, type 2 diabetes, which is also what? A lifestyle disease. Why is it so? Because type 2 diabetes leads to what? Deposition or an increase in bad cholesterol in the system. That's why you see that a lot of people that have type 2 diabetes also have what? Hypertension. So let's just bring out two because of time. Let's just talk briefly about type 2 diabetes, and then let's just talk briefly about weight management. I believe that's going to help us because now we have been able to see that there is a dietary approach to stop hypertension. So why is nobody talking about? Why are people not talking about it so much? Yes, we do about salt intake and all that. But what I'm looking at is that word there, stop, because it means that hypertension is what? Stoppable. So the question now is how? And I've given us an idea by dieting, weight management, detoxification, because the liver is very essential, plays a very essential role with regards to the level of cholesterol in the blood. Exercise is important because it plays a very important role in burning off unwanted substances like fats. Remember that cholesterol and fats are like fat, they are 10 and 10 pence. They are virtually the same thing. Virtually in a layman term, they are the same. And then, of course, professional fasting, which is autophagy. That gives our bodies the ability or the opportunity to consume unwanted substances, which include what? Cholesterol. That is causing the blockage in the blood vessels, and that is also what? Causing the hypertension. That's why you see that when people undergo professional fasting, their blood pressure begins to go down. These are things that I keep telling our people that nobody is going to advertise a drug for hypertension and advertise the side effects for you. Nobody will do that. Who will spend money and pay an advertisement company that go and let me advertise this drug for BP and also add the side effects or also add other options which are natural that you can use to prevent yourself from having hypertension? I also want us to know that one of the most powerful health practitioners we have on earth today are the dietitians. Why are they so powerful? They are so powerful that if these dietitians have the opportunity to do their jobs the best way, fewer people will be in the hospital. Many of us will not have patients to handle because the dietitian is going to help patients to have the best lifestyle to prevent a lot of disease conditions a lot of these conditions that bring them to the hospital in the first place. And if unfortunately, if you go around, you see that their offices are often dilapidated, and the hospitals seem to not to even care about these dietitians. Because truly, believe it, they are one of the most powerful health practitioners we have on earth. Because if they tell you what to eat, the exercise you should do, how to fast, the things to avoid, you will not even have high blood cholesterol that can lead to hypertension in the first place, or obesity that can lead to hypertension. So let's think about this as we move on. So moving on, oh, beautiful. Look at an example of what I'm saying. Just type DASH and hypertension. And you will see that DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet is a healthy eating plan designed to help prevent or treat. I'm not the one that wrote it. High blood pressure, also called hypertension. This thing, you will never see, most health practitioners will never talk about this part. I don't know why. It is there. It also may help lower cholesterol linked to heart diseases called low density lipoprotein. I said, look at it. So why is that nobody talks about this? Well, since I'm talking about it today, I'm going to give us an example of how we're going to be able to, and that's why this our discussion today is very, very important. Anybody that listens to this lecture, health lecture we are having today, and the person knows someone that has high blood pressure, would definitely go and have a rethink of what high blood pressure really is. So this is how hypertension affects the eyes. Of course, we know that it can, the high blood pressure, as blood pressure rises, it damages the inner wall of the blood vessels, causing inflammatory reactions that lead to accumulation of cholesterol and block blood supply to those areas. Of course, it can also happen in the brain, and definitely when it happens, it's called hypertensive retinopathy. These are examples of natural things that can help us to clear these blood vessels and allow blood to flow and help the blood pressure to go down, because the heart will need less pressure when there's less resistance. There's something called Ohm's law. Okay, let's not go there, because that's V is equal to, we're talking about V is equal to IR, that's voltage equal to current times resistance. But it also applies. Since blood pressure is equal to cardiac output times peripheral resistance, that means when you decrease the cardiac output, you see that blood pressure goes down. Or when you decrease peripheral resistance, blood pressure goes down. So taking away those things that are causing the resistance is the key to the reversal of high blood pressure. That is the thing I don't know why a lot of people are not talking about. And I stand to be corrected. If you feel that you have a better opinion, you can get my number and then you call me and chat me up. But as a scientist, I've checked it. I'm not aware of a contrary opinion that you can actually remove peripheral resistance and decrease the need for your heart to pump with the higher pressure and bring your blood pressure down. I am sure. But if you have a contrary opinion, or you have a professor or anybody that wants to say otherwise, please give them my number and let them call me and educate me. I will gladly learn. Now, Arctic Sea contains what is called eicosapentaenoic acid and docosahexaenoic acid. These are essential fatty acids, but they are known to have powerful anti-inflammatory effects. Remember that that inflammatory reactions are also notable around the areas where we have these atherosclerotic plaques, that's this cholesterol blockage. You can see that. And also they prevent the aggregation of what cholesterol that blocks the blood vessels. Then we have garlic thyme that contains lecithin. Go and Google lecithin. It emulsifies fat. And remember I told you that fat and cholesterol are 10 and 10 pence. So what are we talking about here? Why are we not emphasizing on these natural things that have no side effects? Have we asked ourselves the question that all these chemical drugs we are swallowing, where are they going to? Nobody will tell you. I'm a health practitioner. I can recommend, in fact, the drugs in my head, they are uncountable. But I know the truth, and I want to share it with everybody today. I'm not saying that it's a must that one must use the things I'm depicting here, but I'm giving us examples of what I have used for patients and it has worked. This product is as old as the hills. Contains about 200 natural occurring nutritious compounds, but basically they have powerful anti-inflammatory properties. They are adaptogenic. That means if they are part of the body or the cardiovascular system that are damaged, they help to reverse them back, take them back to normal. Then we have cardioheliotropic coenzyme Q10, which is known to reduce cholesterol and also known to help in cardiomyopathy. That's heart muscle issues or changes in the heart muscle shape or form as a result of hypertensive heart disease and other issues associated with them. And because they have contain coenzyme Q10, they help to what? Regenerate and rejuvenate cells in the heart, the lungs, the liver, and kidneys. And remember that the kidneys play a very important role with regards to what? Regulation of high blood pressure. And remember that cholesterol plays a very important role with regards to the level of one's blood pressure. And remember that the heart is what is pumping blood. And remember the heart also pumps blood to the lungs. Let's not forget that. Okay? And also remember that the liver also is important with regards to metabolism of cholesterol. So this product is all, it covers a lot of angles that have to do with high blood pressure. This is a wonderful product because it helps with, it contains L-arginine, which leads to production of what is called nitric oxide, a vasodilator. Remember, we talked about decreasing blood peripheral resistance. Now, if something is a vasodilator, it expands the blood vessels and allows blood to flow better. So what do you think will happen when you take something like this? Your heart will need less pressure to pump because there's better access for the blood to flow. There's no traffic. So the heart does not need to pump with a higher pressure from behind. And remember that there are other parts of the bodies that need this blood flow. We'll talk about that shortly. And hence this vasodilatory effect allows for better blood perfusion, that's flow, hence hindering cardiovascular problems and what? Hypertension. If you go and look at some of this medication we prescribe for you, you will see arginine and maybe arginine metoprolol. You know that metoprolol is a chemical drug that is very good that has to do with cardiac perfusion. You understand? And a lot of other things. I'm giving an example here, just an example like that. We have other beta 1 blockers that help with cardiac perfusion, and you find some of them attached to what? Arginine. Go and check. You will see arginine there. Why are they putting arginine? But nobody is emphasizing on people taking arginine in the appropriate quantity that can help with what? Cardiac perfusion. So these are questions we should ask ourselves. And you can see how it's very essential, even in the incidence of stroke. It helps to prevent and mitigate incidents and a lot of issues. And guess what? This arginine we're talking about is also what? An amino acid, which is a building block for what? Muscles, protein. That means people that are even emaciating, probably as a result of sarcopenia, where they are having excessive, where they are having old age, muscle loss, especially during old age, is called sarcopenia. You can help these muscles to, to grow by giving them this arginine, which is a building block, one of the building blocks of muscles in the body. You see patients that have had a stroke, and because of the lack of use of different parts of their body, that part begins to shrivel. This arginine can help that part of the body to begin to grow back or prevent it from disappearing. Now, as a bonus, just as it helps in the upstream sector, that's the heart region, it also helps in the downstream sector. That downstream sector helps because a lot of blood flow needs to go into the entanglement facility to ensure very vibrant and wonderful entanglement. You understand? And the entanglement arena will be happy. So men should also take note of this. And besides, men are often the ones that have higher incidence of high blood pressure and cardiovascular issues. So that's with regards to that. But we say we're going to run briefly through diabetes. Of course, we know that is a sustained elevation of blood sugar above normal. That is basically what it is. We know that insulin is very necessary. So it's anything that affects the availability or function of insulin in the body leads to diabetes. Then we have two types, type 1, which is juvenile onset, which happens in children. That means there is no insulin. And we have type 2, which as a result of the body not being able to recognize insulin, called insulin resistance, people taking metformin and all that, gavosmate and all that, to help the cells to recognize insulin. But I always ask ourselves the question, have we ever gone to check the side effects of metformin? Then pancreatitis can also cause this, because that means the pancreas itself is sick, and that is the product, that's what produces diabetes. So not even every patient that is having high blood sugar is actually, will I say, diabetic per se. That's based on the normal terminology we know, because it may mean that the pancreas can even be infected, and when this infection is gone, the person's sugar regulation comes back to normal, and we begin to shout, what God cannot do does not exist. And this is one of the things that people even forget, that pancreatitis sometimes forget this. Yes, people don't even remember because when people just go to high blood sugar, hey, metformin, and but nobody has thought, would this be as a result of pancreatitis? These are things that we need to also check to know. Now, these are the signs and symptoms. You can see this guy rushing to urinate. It causes excessive drinking of water. Because, in fact, first of all, it starts from excessive urination because the body is trying to remove excess sugar. And as the body is removing excess sugar with water, there's decrease in water in the body, then the person becomes thirsty. And remember that the cells of the body are not even having enough glucose because the insulin is not there to allow the glucose come in. And then it will lead to, they cry out to the brain that they are hungry and leads to excess what? Eating. And that's why the 3 Ps are called polyuria, polydipsia, polyphagia. That's just Latin for excessive urination, excessive drinking of water, and excessive consumption of food. So we're running through diabetes, and these are the signs and symptoms, which blurry vision, weakness, mood changes, and a lot of others. Paresthesia, that's the diabetic neuropathy, which is the pain that people feel on the extremities, on their feet, and all that. But let's bear in mind that high blood sugar causes diabetes and diabetes causes high blood sugar. We're going to talk about this show soon. This type 1 diabetes, type 2 diabetes, and more about it. These are the complications. These are where it attacks. We're running through. The reason why I'm talking about this is because diabetes leads to what? This is where I'm coming to high blood cholesterol. And you can see that because it leads to high blood cholesterol, what do you think will happen next? The high blood cholesterol will lead to what? Hypertension. So you can see that type 2 diabetes can cause hypertension and lead to a lot of other factors. This is the link between diabetes and hypertension. They go hand in hand because the cholesterol blockage caused by diabetes leads to an increase in what? Peripheral resistance. This is where I was rushing to. An increase in resistance to blood flow leads to a compensatory increase in blood pressure by the heart to overcome such a resistance to blood flow, leading to what? High blood pressure or what? Hypertension. Remember this formula we spoke about? Blood pressure is equal to cardiac output times peripheral resistance. That's the budget for diabetes. It's another budget for diabetes. Terrible. Now, we'll talk about this later. These are the ranges for. Bear in mind that the normal range for blood sugar is not 80 to 125. That is what people that sell Coca-Cola and Fanta will tell you. So that when your blood sugar is about 110, you won't stop drinking Coke or buying Fanta. The normal range is 80 to 100. That is the normal range of the fasting blood sugar. So let's bear that in mind. We'll talk about this later. This is the epidemiology of diabetes. These are the challenges in management of diabetes. This is how diabetes affects the eyes. Okay, so you can see diabetes leads to an increase in bad cholesterol levels that lead to cholesterol blockage of blood vessels in the heart and other parts of the body, lead to cardiovascular disease. The similar thing happens in the eyes and leads to diabetic retinopathy. This is how we can prevent or manage diabetes. We'll talk about the reversal of diabetes, type 2 diabetes. Let's ask ourselves questions. These are what natural pharmaceuticals can do with regards to helping to. These are just a few of these things that can be used that we use in management of type 2 diabetes. And you can see them by rushing somewhere, weight loss and detox. This is so important. Now you can see that obesity is one of the major causes of hypertension. And that's why we are here. And this simply means excessive detrimental accumulation of body fat. And this implies our weight is directly influenced by the amount of body fat in our system. Fat is a way our body stores excess energy. And energy stored in food is measured in what? Calories. Hence, the higher the calories we consume, the higher our tendencies to accumulate energy stores in bodies and bodies. Some people say, I don't know how I'm getting fat. When I breathe in air, I begin to add weight. It's a lie. You are what you consume. Because you are consuming energy as food and you're not expending that energy sufficiently, what happens? It finds a way to store itself in the body, and that is stored as fat. I've said this 1,000 times. See? Then you can see, if you look at this picture here, you can see that the left side is winning, meaning that this person is going to will have a good weight, because exercise is helping the person to burn off more fat, more energy that the person is consuming via his burger and drink and soda. You can see that. And that means, from basic principles, weight management is a function of what? Calories consumed versus what? Calories expended. I want us to understand how to reverse hypertension via just this one topic. Because of time, we can't talk about the other ones. But let us know this one and master it. And know that via weight management, we can have the opportunity or chance to reverse or mitigate negative effects of hypertension. Weight management is the process of achieving and or maintaining a healthy weight via certain activities, techniques, and what? Physiological processes. Let's take note of this. So these are the ways we measure whether someone is going to be adding weight or decreasing weight. It's just a function of the calories consumed versus the calories expended. Remember, we talked about this vegetarian diet. I keep showing it over and over again. So examples of factors that influence weight gain or loss include dieting. You see, you are what you consume. And remember, a Mediterranean diet is a good example. Exercise helps burn off calories, and certain diseases make people lose weight. And genetics, look at it, inherited tendencies. Somebody say, my father was fat, my mother was fat, grandparents were fat, everybody in our village is fat. That means I should just sleep in a fast food restaurant all my life and be fat too. No. It just means inherited what? Tendency. It doesn't mean that you must be fat. In fact, if someone that has a fat father and a fat mother is born in a period of war, that person can be as slim as a model. But if the person is born where we have a very good government and everybody has excess opportunity to eat whatever they like, and the parents are both slim, the person may even be fat. Oh, I love this picture. We talked about this earlier, all things bright and beautiful, amazing. Now, body mass index just gives us a fair measure, but just know that a body mass index of 18.5 kilograms per meter square to 24.9 kilograms per meter square is essential for us to, in fact, that is the normal range for body mass index. Anything below this is malnourishment, and anything above that is what? Being overweight or obesity. Yes. So this is the importance of weight management. Because if we talk about what being overweight leads to, then we already know what the importance of weight management is. And you can see number 4 here is what? Hypertension. Apart from that, it causes type 2 diabetes, hormonal imbalance, infertility, polycystic ovarian syndrome, endometriosis, and amongst others, causes stroke, heart attack, cancer, low immunity, fatty liver disease, osteoarthritis, breathing disorders, increased internal stress, and free radical damage of DNA. Number 4 here is very, very crucial to us today, which is what? Hypertension. So that means if we are managing our weight, you can see that a lot of people that have, some people are slim and have high blood pressure, but remember, somebody can be slim and have high blood cholesterol. So weight management is just one of the ways we can help to give ourselves the opportunity to manage, reverse, and or prevent hypertension. So you can let's talk about detoxification, because the liver plays a very large role with regards to what metabolism of cholesterol in the system. So the medicinal or physiological process of removal of harmful substances from the human body, especially by the liver and the kidneys, is simply what? Detoxification or detox. The presence of unwanted materials leads to oxidative stress that leads to production of reaction of this species. We mentioned that already, that can damage DNA. And you can see the side effects of this, which include rapid aging, cancer, and more. But let's talk about toxins, because these toxins are one of the reasons why people are having what they call rebound weight. So people are having rebound weight because these toxins have gone to hide inside the fat. Then when they go and undergo what is called malnourishment, thinking that they are undergoing weight management, after that, the liver will send more fat globules to go and re-dilute those toxins that were hiding in fat cells, and the person has rebound weight because the person starts to add weight again. So you must have to detoxify yourself. There was a video I was watching on how they are producing rice that Nigerians are eating. Say, give me foreign rice, foreign rice, foreign rice. So these foreign rice are actually not foreign. They are from somewhere close to hell. They are making these things with chemicals that you will not believe. They show you these chemicals. You wonder why sometimes you finish eating rice, you feel like throwing up. You didn't eat rice, you ate poison. You understand? Most likely. So we have to be careful. We have to detoxify ourselves. Have we ever wondered why our ancestors used to live longer than us? It's very clear. They didn't have those things we are having today. All these substances we are eating. You see that some people, they eat processed meats that contains a lot of nitrites and other substances used to preserve them. People are drinking all sorts of things that have all forms of preservatives and unwholesome chemicals, monosodium glutamate, and all these things are all poisonous to our system. And that's why a lot of people are living less than those days. Ancestors will take palm oil, they will take the vegetables, they will take the what's that thing, the locust bean thing, they do all those stuff, put onions, sliced pepper in there, and they just eat, and that is brunch. After going for exercise in a farm, burning off excess calories of the previous day, why would they live longer? And these are the things we need to consider. So these toxins accumulating in the system are also responsible for people not living up to the normal life expectancy. A small example of the dangers of toxins that are hiding inside fat cells is when you see some women are having what? Infertility. They don't even know that apart from fats being responsible for hypertension and all these other things in many cases, as being a strong risk factor, it can also lead towards infertility. There's something called androstenedione that is converted in fat cells to estrone and can disrupt parts of the brain that are responsible for what? Regulation of female sexual and reproductive function. If you ask many women that are fat that are not getting pregnant or having infertility, ask them whether their hair practitioner has ever told them that they should go and reduce their weight. Out of 10, I doubt if 5 have been told. I'm telling you. So there is a mystery why people are always in a hurry to go and drink methoprogesterone. They take all sorts of things. They take, what's the name of this other one that is clomiphene citrate. They want to get pregnant. They drink all sorts of things. They have forgotten that you are drinking these things and you are fat. If you ask yourself why before treating what? It's just on the side. You can see. But this is very important to us. It's worthy of note that fasting appropriately, remember we mentioned professional fasting, is to help to detoxify the liver. And you know that the liver plays a very big role with regards to what? Cholesterol metabolism or processes in the system. You understand? So the liver helps us to metabolize cholesterol and regulate a lot of things that have to do with cholesterol. And remember that cholesterol is strongly linked to peripheral resistance, which is also strongly linked to our blood pressure. So detoxifying the liver in one way or the other also helps us to regulate our blood pressure. You understand? So these are the things we're talking about. Then drinking enough water helps to detoxify the system, especially via the kidneys. Remember I mentioned that the kidneys play a very strong role with regards to blood pressure because they have the juxtaglomerular cells that produce renin that is converted to, at the end of the day, ends up and that produce substance angiotensinogen that is acted on by renin and other substances that will lead to angiotensin at the end of the day that constrict blood vessels. That means the kidney also needs to be healthy. And when the blood vessels are constricted, it means that there's resistance to blood flow, increased peripheral resistance, blood resistance in the blood. Hypertension is on the way. Just imagine how toxins are stored in some people that's wearing this Agbada 1,500 and they're happy, they have a pot belly, but they are just landlords of toxins that are damaging issues, that are damaging their bodies. You can see? So these toxins are hiding those fat cells. You see, when I present this Clean 9, I've had 100% success rate with regards to resolving a lot of issues when I give patients this product. In fact, today I received a call from a patient in the US that some other patient that I gave this product to gave her my number and she called. I received a lot of calls from people because there is a way I apply this Clean 9. It's a very powerful tool. So people think, hey, this is a supplement. Remember that there's a very thin line between natural pharmaceuticals and supplements. Remember that the definition of a drug is, in a very late definition, anything that is given that can elicit therapeutic activity. You understand? That's what a drug is. That means if I'm going to break it down, even your food is a drug that cures hunger. You understand? So when we're talking about supplements, somebody says supplements for supplementation, but when it is applied with the desire to achieve a therapeutic goal, it is no longer a supplement. Some of us take low dose aspirin, baby aspirin, 75 milligram aspirin daily. It's not as if they are having problem already, but they are told that when they are 40 years and above, they should take it daily, one a day, right? Is that not supplement? But if somebody is having hyperpyrexia, which is high fever, and the person is given aspirin, which is the higher dose of the same medication, is the same chemical composition, acetylsalicylic acid, that is still in that aspirin, your Fensic, your Alabucum, Medic 55, Shaky Daddy, all of them are what? Aspirin. But you see the thin line there is that this one is for what? Maintenance, and this one is for therapeutic activity. So when you are giving this thing for therapeutic activity to take place, you don't treat it as just supplement. Better take it seriously because it is a drug at that point in time, a natural pharmaceutical. So it's a 9 days detoxification and weight management program designed to reduce caloric intake and increase caloric expenditure systematically via use of low-calorie diet plan, exercise, autophagy, which is therapeutic fasting. I've mentioned fasting again because you have to detoxify the liver. The liver is its own doctor. There are virtually no drugs to help the liver. The liver is the chief destroyer of drugs. The liver takes care of itself, remove the things that are causing problem, and it will regenerate and heal itself back. That is just the treatment for every liver. That's why detoxification of the liver is key. Now, and then, of course, natural pharmaceuticals, while ensuring adequate nourishment. This adequate nourishment is the difference between, is what a very key difference between people that are doing malnourishment and weight management. Some people say that I'm losing weight. They go to the restroom, they use the White House 200 times, and they say, I've lost 10 kilograms. Why eat again and tell me whether that 10 kilograms should not come? Just empty your bowels. Some people undergo malnourishment by denying themselves of nutrients, and then their cells become shriveled and exposed to they're fragile, and they say that they have lost weight. That is not professional weight management or weight loss. This is how you lose weight professionally. And also it systematically includes intermittent or appropriate fasting that helps with what detoxify the liver via what autophagy. I have to say that again so people understand. It's not an easy thing to do. In fact, I also give my patients 10 to 30 days additional. I call it locking in the new weight because your brain knows your way to find out that shortly. Okay, so these are the features and benefits of C9. It contains this. Of course, you know that this product is, you can't finish talking about it. Indeed, it's functional and numerously numerous. But of course, DNA damage and detoxification of the system via antioxidants and other things and adaptogenic qualities that help the body to heal faster are just a few. Then we have this product that ensures that nourishment is, the cells are being nourished as they are reducing their weight, as they are releasing the fat that we don't need because of our weight. They are not suffering, so they are what? Being nourished. Fiber helps with the stomach and all that, as you can see there, and also helps to reduce hunger cravings. And also remember that there's a link between our gut and our immune system. So you can see that will also help with immunity. Of course, this is STEM or thermogenesis. That's help us to burn out fat and help us to produce energy. That's why when you are running this program, you see that you're not going to be getting tired. Why? Because the fat that is in your system causing problem is being converted to what? It's being burnt off and converted to energy. So that means it's double gain. You are gaining energy and you are losing weight at the same time. This product gave some people Nobel Prize. That means they discovered that hydroxycitric acid in this product from Garcinia cambodia can help us with regards to preventing conversion of fats to carbohydrates. Remember that most of the things we eat are carbohydrates in this part of the world. So you can see why people that are always selling food are having buka and canteen. They're almost always fat because they taste this, taste that, taste this, and they're mostly tasting carbohydrates and they're already getting fat. Of course, it contains measuring tape and a book guide to help us. Now, these are 10 reasons why we need this weight management and detox program. You see, detoxifies naturally and nourishes the cell at the same time, boosts immunity, improve our mood, boost libido for those people that are entanglement fans, reset metabolism, those of us that are entanglement fans, reset metabolism, that's boost energy and all that, rejuvenates from inside out, and gets very good night's sleep, helps to act against insomnia, of course, mental clarity, to plan and execute, and all that. You see, there are a lot of things there. Some people become boutique friendly and all that. And you see, so these are things that there are so many because of time we can't, but let's just quickly let's just put these products one-on-one with the problems we are talking about. Remember that obesity is a strong risk factor for what? Hypertension. So the three major ways that fats are accumulated: direct injection, poor elimination, and intracellular production. And these are the ways we take care of that. Hydroxycitric acid is there, you see. That's how the thermogenesis helps to burn fat. Then translocation of cholesterol, because increased high density lipoprotein, which is good cholesterol, you understand, helps the liver to metabolize bad cholesterol from the system, because that will help to transport the bad cholesterol back to you. That's it. So you see, it helps us to detoxify our system via this. You can see that. So you can see this, entanglement fans enjoying themselves because the CNN has helped them to reduce weight. That guy's already having 6 packs over there. The woman is happy with herself. Boom, this is where we are going to. Now, rebound weight gain. A lot of patients ask me, how do we lose weight without coming back? That's a very powerful question. This is simply the resistance of the body to weight loss. Because anytime you lose weight, your brain will send a signal to your nose and other parts of your system. If you are in South Africa or you are in Tanzania, somebody is roasting suya or doing barbecue in Nigeria or Ghana, you'll be smelling it if possible, because your brain wants to eat and take you back to your former weight, because your brain knows your weight. So how do we solve this problem? Now, this postulates that there's a disconnection between the gut and the brain. Hence, while the gut is saying it's full, the brain is saying I'm hungry. Hence, this means that your brain knows your weight and tries to ensure that you eat until your weight loss is gained back. Now, how do we lock in our new weight? Thanks to hydroxytric acid found in Garcinia plus, absorption of excess food is hindered by the gut until the brain calms down. You see? And this and other metabolic functions of C9, like thermogenesis, translocation of cholesterol to the liver, etc., helps us to lock in our new weight from the 10 to 30. That's just specially for me and for my patients. The 10 to 30 is added to that, the 1 to 9. So thank all of us for being here today. This was actually, I wanted to just have, I didn't want to summarize too much, because this is a very sensitive topic, as people are having high blood pressure and they do not know that it's a lifestyle disease and there's a possibility that it can be reversed. Okay, you can reach out to whoever has sent this link or this video or this lecture to you. One way or the other, it will get back to me. So you see, you are what you consume, and there's a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on what's the winning side. I thank everybody for coming. And at this juncture, if we have any questions to ask, we can also do that. Thank you for listening, and God bless. Looking forward to hearing your questions. Okay, I remain my humble self, Dr. Drugs, and that's what we have for tonight. Hopefully, some other time we'll talk about how to reverse. We'll talk about the reversibility of type 2 diabetes, and let's see how it is possibly reversed. Thank you so much for listening. God bless. So, at this juncture, I remain my humble self, Lucky, aka Dr. Drugs, and it has been a pleasure sharing the little I know with all of us. So, from what we have learned today, let's ask ourselves the question again: is hypertension reversible? From what we have learned, I believe we should know the answer by now for most cases of hypertension. Thank you very much, and good night. Bye.